Bama, Monguno, Dikwa. For months, access by road to these towns was impossible, leaving thousands of people trapped by the conflict opposing Boko Haram and the Nigerian army. At long last, it's possible once again to get through to these towns. MSF has to travel under armed escort or in helicopters. The needs are immense, like in Bama, where 10 to 15,000 people are living.
We've been queuing for 3 days now. There's no water, that's what's worrying us. There's no food either. We're all hungry. We have no shelter and no clothes. That's what we need.
During each visit, the team seeks out the patients most in need of emergency medical treatment.
So they are going out through the camp and finding the children that are in bad condition and children that need medical care, and those that will need to be referred here to Gwenge. They stabilize them as much as possible, and then every week or every 2 weeks, in as much as possible, when we have a movement, we bring as many kids as possible from the camp to Gwenge.
Gwenge is a health centre in state capital Maiduguri. MSF plans to double the number of beds here, 120 at present, as the centre is constantly overcrowded.
The patients cycle through quite quickly. Yesterday we discharged 14, but we admitted 12 because there was a movement that came from Bama bringing many of these sick children. And so we are planning, we're putting up more tents, and we do expect our activities to continue to increase. Not only as we gain access to more camps, but also as the rainy season sets in and malaria season is starting, and we know that with malaria comes a lot of malnutrition, and so we will start to have increasing numbers of malnutrition.
Fan is a member of one of the families who have come from Bama. One of her granddaughters was suffering from malnutrition and needed treatment. Fan, whose husband has fled to Cameroon to escape Boko Haram, lives alone with her children and grandchildren.
This is how we organise our space. We sleep here with our children. When it rains, I sit here and them over there. You can see the holes. When it rains, we sit there because it leaks. This is where I cook food. If I can find something to eat, I cook it. If I can't, my auntie gives me some food.
When Fan's granddaughter left hospital, they didn't return to Bama. With her husband in Cameroon and one daughter abducted by Boko Haram, Fan is just one of the 2.3 million people displaced by the conflict raging throughout the region.